Hello and welcome. Thank you for joining us today. My name is Karin Sitte and I'm Program Manager responsible for the Foundation's Health Pillar. So before we start, I'd like to acknowledge the Wurundjeri people of the Kulin Nation, who are the traditional custodians of this land on which I am today and of which the sovereign was never ceded. I would also like to pay my respects to elders past, present, and to any Aboriginal and Torres Strait Islander people who are tuning in today. So again, thank you for joining us. Hopefully this session will assist you in understanding the Foundation's medical research program. During the session, I will provide an overview about the program, some recent changes in our processes and priorities, and then some examples of successful grants, and we will have time for questions at the end. You're most welcome to put in questions into the Q&A section at any time throughout the presentation, and I will answer them as many as I can at the end. If you're having any technical issues, please use the chat function and only use the Q&A to ask questions about the content of this presentation. So just a little bit of background about the medical research program. So at the Ian Potter Foundation, we have 4 pillars: healthy, fair, sustainable, and vibrant. The health pillar has 2 streams. One is medical research, where we fund equipment, which is what we're talking about today, and the public health stream. This program was established in 2015 and we conducted an internal review in 2024 and concluded that there's still a need for this program in its current form as it provides a valuable contribution to Australian research. The total funding available is around $2 million. It varies from year to year, with capacity to fund between 12 to 15 proposals each year. So the overall aims of the program, as stated here, are to advance the understanding and improve treatment of major diseases by supporting leading Australian research institute, universities and teaching hospitals in innovative biomedical research. The Foundation will consider applications to support the provision of equipment and capital infrastructure to support outstanding research group. So important information. Our preference is for each organisation to provide us with a single proposal. Organisations can be collaborators on multiple applications, but we would only like to receive, our preference is to receive one from each organisation. On our websites, it says that we'll accept up to 2 ranked applications, and I just want to clarify that that is for exceptional circumstances, because we understand that in some larger organisations, they may have to choose between unrelated applications from different schools or different departments. In those instances, they have to be ranked. So I just want to reiterate, this is not an invitation for everyone to submit 2 applications because that would be quite overwhelming, but we will consider 2 from larger organisations in exceptional circumstances. In terms of eligibility, if you're holding a current medical research grant, then you're not eligible to apply in the upcoming round. So this means if you were awarded a grant in September 2025, which was the last round, you're not eligible to apply in the coming round. If you are awarded a grant in September 2024, you may become eligible to apply in the coming round if you can meet the reporting requirements and acquittals before before the round closes. I mean, we'd like to discourage rushed acquittals or early acquittals and to meet eligibility criteria. But if you're in a situation where you're close to acquitting your existing grant and you want to apply in the next round, then it's best to have a discussion with me first. For the proposals, we would like to see a single instrument or a piece of equipment rather than multiple. We like to discourage packaging of multiple pieces of equipment, each valued under the minimum grant amount, and I'll tell you what that is in a minute. Also, I like to remind everyone that we will not consider resubmission of previously declined proposals. So the minimum grant amount is $100,000 for this program area, and we don't usually fund 100% of the equipment cost. So this means that we're looking for proposals for a single instrument priced at more than $100,000 where we're requesting for a contribution from us. In terms of co-funding and matching funding, the co-funding must be cash to purchase the equipment, and it can come from the applicant, it can come from other funders or collaborators. In-kind contributions are optional, and if they are included, they must be directly related to the operation of the instrument. So the funding is for the purchase of the equipment only, and it cannot be used for other expenditure such as maintenance, consumable, staffing, or overhead. The grant period is for 18 months, and this allows for procurement, installation, training, and a 6-month period of use. The 18-month timeframe means that organisations can only realistically apply every second round or every 2 years. We rarely see a medical research grant completed in 12 months because they're usually unexpected delays somewhere along the process. So moving on to the application process. This is a single stage process. There's no expression of interest, and we've brought forward the round for 2026. The round opens on the 2nd of February and closes on the 26th of March, and funding is for the 26-27 financial year. So the decision will be made in around June, and the funding is for the following financial year. As I already explained, our preference is for a single application per institution, except for exceptional circumstances where you may submit up to 2, but they have to be ranked by the institution. Applications have to come from researchers, must be processed through their institutional research and advancements office or trust and foundations manager or equivalent, because our expectation is that the advancement office or the research office understands both the institutional needs and the foundation's priorities, and will select a proposal that strongly aligns with the foundation funding objectives. So if you're a researcher, your first port of call is really to discuss it with your advancement office. The process to apply. So read the guidelines and instructions on the website, check that your proposal meets the criteria. Then talk to your advancement team and follow their instructions, who will then collect applications and decide which one's the best to go forward. There is the option to book a phone appointment with me if you need to discuss your application. It's entirely optional, and we'll have a link on the website to book appointments, which will open in late January. There is an application template available on the website, which you can use to prepare your application. But it's important that you then submit your application through our Giving Data Grantee portal by 5 p.m. Melbourne time on the 26th of March. And please be mindful of time zone differences because that still falls within daylight saving time in Southern Australia. Moving on to the funding principles. So applications are assessed against our funding principles, which are leverage, collaboration, innovation, excellence, sustainability, and potential for impact. So given that these are generally big ticket items, it's unlikely, as I said, that we will fund 100% of the cost of the equipment. So in this case, leverage refers to co-funding from your own institution, collaborators, or other funders. And co-funding doesn't have to be all confirmed at the time of application, but if the project is funded, then we expect that to get confirmation of any unconfirmed funding. And we will only release the funds once all of the funding has been secured. There's a limited grace period that allows you to secure that funding, and your grant will be awarded on the conditions of the funding being available. Under collaboration, we're looking to fund purchases of equipment that is going to be used by many research groups, both internal and external, to drive innovation. With sustainability, we refer to working life of the equipment, which we expect to be at least 10 years. And with impact, we're looking at applications where the equipment can be used to answer many different research questions that drive innovation across many different disciplines. So the more of these principles you can tick off with your application, the more likely your application will be competitive. In terms of priorities, we don't have a priority area that targets a specific disease or research discipline. The key component for success is to link back to the funding principles. So significant co-funding, strong collaboration and support from partners as evidenced through letters of support, wide application and use for the proposed equipment, both internal and external, addressing a gap in research capability, long working life of the equipment, and obviously adherence to guidelines and eligibility criteria. So what we're really looking to fund is equipment where there's a capability gap to drive innovation. It's going to be used by many research groups and has application to answer a wide variety of questions in different diseases and disciplines. Things we will not prioritize in this round. So we do not fund diagnostic or sample processing equipment or other equipment needed for the usual operation of a hospital or health service. We would discourage the packaging of multiple pieces of equipment into one application. We will not prioritize laboratory upgrades or software solutions and equipment costing less than the minimum $100,000 grant amount. A recurrent expenditure such as staffing, consumables and maintenance are not to be included and can't be used. This grant can't be used for those expenses or institutional overheads. Also, equipment that might be funded internally or by government agencies such as the NHMRC or ARC is also not prioritised. So if you have a grant for a specific purpose and it has equipment contributions included, if it's just for one project, it's unlikely that we're going to fund it. And we will not prioritise equipment for commercial purposes. So I just want to give a little bit of an example of what's expected in the budget and leverage. The budget template is really intended to be very simple. So what we're looking for is a line for the amount that you're seeking from us, which should be at least $100,000, which is the minimum. We want to see a line for the cash commitment from the applicant, a line for the confirmed funding from other sources, and a line for unconfirmed funding from other sources, if that's applicable. So in this instance, in this example, we've got a piece of equipment that costs $200,000. The applicant is seeking $100,000 from the foundation. They've got $70,000 cash commitment from their organisation, $20,000 from other sources, which could be other philanthropic grants or partners, and unconfirmed of $10,000. And then an expenditure line is just simply the capital equipment cost of $200,000, and expenditure and income should match. You'll notice I have an in-kind line in there, which I've put in as operational staff salary. In-kind is not really counted towards leverage. You can put it in, but we'd like to see that any in-kind that's included is actually directly related to the equipment and not like entire NHMRC grants or anything like that. So in this example, the leverage is 1-to-1, where the applicant has raised $1 for every dollar that they're requesting from us. So what counts as co-contributions? In this instance for these grants, because they're capital equipment, it's really just cash towards the purchase of the equipment. And this can come from the applicant organisation, from faculties or departments, from other foundations and trusts, from collaborators, from partners. What we don't count as contributions are in-kind contributions such as salaries and wages, entire NHMRC and MRFF grants, consumables, institutional overheads, or grants where there's only an in-kind contribution and no cash contribution. So I hope that will provide some clarity around the matching funding. So what does a competitive application look like? The proposal will be for a single instrument. The funding request is a minimum of $100,000. The case for support is clear and aligned with the funding principles. There's strong collaboration, either internal or external, with letters of support from all named collaborators. The budget is simple and easy to understand, where income matches expenditure, as I've just shown you. Co-funding from all sources is clearly specified. Co-funding only includes accepted items, in this instance cash. Any equipment quotes exclude consumables and service contracts and match the expenditure line in the budget. There's also strong leverage of foundation funds, and any in-kind contributions, as I mentioned, are optional, but are directly related to the equipment. For example, operational staff costs, service contracts, and partner in kind. So I'll just move on to give you some examples of recent medical research grants that we have awarded. The first one is for the Children's Medical Research Institute. The equipment that they requested funds for was the Cell-N1 Neo single proteomics equipment. And the grant to them was from the foundation was $150,000, which was 26% of the total cost. This equipment was needed to overcome technological limitations of proteomics bulk tissue analysis. It had strong collaboration and support from the Westmead Health Precinct, and it was going to be integrated with a recently acquired mass spectrometer. The equipment life is 12 to 15 years, and why we funded this is because it's new technology addressing a capability gap in a metro research precinct, a wide range of application and essential to drive innovation in health research, and significant co-funding support from the applicant and partners. The next example was a grant awarded to the James Cook University for the Cytek Aurora spectral flow cytometer. The grant from the foundation was $200,000, which was 54% of the total cost. The need was replacement of the equipment at end of life, of service life. So the flow cytometer they had was over 15 years old. Critical capability in northern remote Queensland, used by multiple research groups across different organisations, and it improved data accuracy, quality, efficiency, and also provided cost savings. Why we funded this? Supporting a unique capability in venom research and biological significant models not available elsewhere in Australia, strong support from the host institution and collaborators, and remote research capability gap. And the last example is from the Baker Heart and Diabetes Institute, where we funded the Zeiss Cell Discoverer 7, which is a microscope. The grant was for $151,448, and that was 19% of the total cost of the equipment. The need was the new technology for live cell imaging with precise cell environmental control, driving innovation in mRNA treatments for cardiometabolic disease, and there's no comparable technology available anywhere in the state. The equipment life is over 10 years, and we funded this again because the new technology addresses a capability gap in a metro research precinct, and there was significant co-funding from several sources. I think I'm just going to stop there and allow some time for people to ask questions. So the first question I have, is there a maximum request amount this year? There isn't usually a maximum. I guess it's dictated by the cost of the equipment. We will not fund the full cost of the equipment. We will only fund a proportion of it, and it depends on the matching funding and the proposal. So generally they range between $100,000 to $200,000, $250,000, but that's been in the past. It depends on what's being asked for. The next question says, if our current medical grant ends in December 2025, can we apply for funding in 2026? If the grant ends in December this year and you are able to acquit and report before the closing date of the 2026 round, which is in March, then yes, you can apply. Oh, okay. So is there a preference toward equipment that is tied to a specific project versus equipment that will belong to a facility or platform? Generally, we prefer to fund equipment that will be used by lots of people. So when if in a facility or platform, it's more likely to attract funding than if it's for a specific project. There's a question about the minimum cash contribution from the organisation. There is no minimum cash contribution, but this is a competitive process. So depending on the organisation, if it's a a regional organisation, the committee might be more likely to fund a higher proportion, say, than a metropolitan one. But there is really no minimum cash contribution. And again, it's competitive. It depends on what other applications are in place as to how it stacks up. What is the makeup of the panel reviewing the grant submission? Experts who understand what the equipment is about. That's all I can tell you. Next question. If my institution is successful in this round, will it affect its chances of success within our other funding streams? No, and I meant to say this in my presentation, I forgot. So you're eligible to apply if you hold any other Ian Potter Foundation grant from any of the other streams and the public health stream as well in the health pillar. But if you have a concurrent medical research grant, then you're not eligible to apply. Are servicing and maintenance costs allowed to be included? As I mentioned during the discussion about the budget, that we expect that those will be in-kind contributions from the organisation. We want to fund the cost of the equipment. Can the grant be used for refurbished equipment? The grants are intended for buying equipment that you currently don't have. So we don't fund retrospectively, but if you're buying a piece of equipment that is being refurbished, that is not at your institution, we'll probably consider that. Is there an advantage of applying for equipment that would harmonise with existing equipment? I don't think there'll be any advantage, but obviously when you're building platforms and you need multiple pieces of equipment that interact with one another, then that would be obviously favourable for you. And we will consider it in the context of how competitive the application is overall. Can we get scoring criteria guidelines? There are no scoring criteria other than alignment with the funding principles, which I've outlined before, and the committee will make a decision on that basis. So it's not like the NHMRC. I think there's no further questions. We'll wind up the session. Thank you very much for listening in.